are you doing? My name is Isabel Sendra. I'm a student nurse at USM. Today I'm going to be inserting a Foley urinary catheter. The doctor ordered it because you're about to go in for knee surgery, and that's a standard procedure anytime you go under surgery to relieve urinary retention and to relieve the bladder of any urine before, during, or after the surgery. All right, before I start, can you please, I'm gonna check your armband, can you please tell me your name and date of birth? All right, Mr. Smith, and also before we start, I wanna know, can you please tell me if you have any allergies, especially iodine, betadine, or latex? All right, you don't, sounds good. And also before we start, I'm gonna put you in the supine position. And if you were a female, I would put you in dorsal recumbent. But because you're a male, I'm gonna put you in supine, and I'm going to raise the bed to working height, which is elbow height. And I'm not gonna actually do it, but I would put the side rails down. And before I start, I'm also going to wash my hands and put on some clean gloves. And also, I'm gonna explain this procedure. Please tell me if you have any questions, but for a Foley catheter, what I'm going to do is I'm going to lubricate a catheter and insert it into your urethra. I'm going to administer some perineal care beforehand, so I'm just going to use a basin, some towels, and some soap and water, just to make sure you don't get any infections during this. Alright, I'm going to try to maintain privacy, but please do tell me if you do have any questions or you do have experienced any discomfort. Alright, so I'm going to put one of these underneath your groin area to catch any water that might spill. And then one of these over your abdomen. I'm going to take this cloth and I'm going to insert it into the water and soap. And I'm going to clean the meatus in a circular motion outwardly. And with every stroke, I'm going to use a different part of the cloth and soak it, and then clean the meatus outwardly in a circular motion. And then use a different part of the cloth, and then clean down the shaft down towards the pelvic bone, and use long strokes for that. So get a different part of the cloth, clean down the stroke, a long stroke. And then clean down and a long stroke. All right. I'm gonna put this in the dirty laundry. And then now I'm going to take my gloves off. Maybe put this to the side. And then I'm gonna throw this out because they're not sanitary anymore. And I'm gonna start putting in my sterile gloves. And I'm gonna maintain sterile field, but if I do break sterility, I will voice that and recognize it. So this I'm going to use as a trash bag. I'm going to put this right here. And I'm going to put this to the side. Place this over here. And here's my sterile gloves. And then I'm going to place this right over here. Make sure not to touch in everything from 1 inch on the outer 1 inch areas are non-sterile, but I'm going to make sure not to touch anywhere further than that. Again, to maintain sterility. Okay, it's going to grab this from the outside. Scoop this in. All right, I'm gonna put this to the side, and then what I'm gonna do is I'm gonna place one of these cloths over the abdomen. Well, I'm actually gonna place this one underneath the groin to maintain sterility. And then I'm going to place this one over your groin to maintain sterility. All right. Okay, so before we begin, I'm going to make sure I keep my arms, or well, my hands, in the sterile envelopes above my waist and not to let it go below my waist or break sterile field. So I'm also going to place this right over here. Place this right over here. And then I'm going to set this up beforehand. I'm going to take this sheath off and like throw this away. Into the trash bag. And then what I'm also going to do beforehand, I'm going to insert the syringe with water onto the catheter tubing port. Make sure that's nice and deep in there. All right, and then before I start, I'm going to get my betadine, which has iodine in it. I'm going to rip it open and then insert it into this little container, throw that out, and then what I'm going to do, I'm going to take an applicator and I'm going to take one of these cotton balls and I'm going to hold the meatus with my non-dominant hand. I'm going to dip this into the betadine and I'm going to clean the meatus in a circular motion. And then with every stroke, I'm going to throw away the cotton ball because it is non-sterile anymore. So dip it again, clean it in an outward circular motion, and then throw it away. So then I'm gonna clean the shaft, and I'm gonna clean that in long downward strokes towards the pelvic bone. And throw out every time after I use it. So one stroke, and clean it down. And I'm gonna get it again, dip it in the betadine, clean down towards the pelvic bone. All right, so once I'm done doing that, what I'm gonna do is I'm going to keep my hand on this, take the lube, well, move this applicator first, and then I'm going to insert the lube into the urethra. I'm not actually gonna do it because that would be messy, it's just practice, but in a real patient, I would insert it all the way into the urethra and then throw it away because it's not sanitary anymore. And I would then take the catheter, and what I'm gonna do, I'm gonna insert it on the count of 3. Can you take a deep breath? I'm gonna insert it slowly and gently. So 1, 2, 3. And then for a male, I would insert it all the way slowly, all the way towards the, where the tubes make a Y. And then for a female, I would insert it 2 to 3 inches and watch for urinary return. Insert it all the way to the Y, and then what I'm going to is I'm going to take my syringe and then insert it and inflate that balloon. Insert it slowly. Okay, make sure it's inflated. Throw that out. Well, actually, I would not throw that. I would keep it in here because I have to use it later on. Well, actually, yes, I would throw that out. I'm going to use a different syringe later on when I do remove it. And then, okay, so after I am done doing that, I'm going to slightly pull it until I get some tension. That lets me know that's like the end of the bladder and it's in place. And then what I'm going to do is I'm going to take this bag and I'm going to insert it. Make sure it stays below the bladder. I'm going to insert it, not on the bed rail, but on the bed itself. So for here, it would be right here, okay? And then also I would make sure to strap this to the abdomen because it is a male. But if it was a female, I would strap it onto the upper thigh. Okay? And also what I'm going to do is I am going to collect a urine sample. And what I would do is I would take a clean container, and if I need a sterile one, I would take use the catheter tubing port. But I would have to wait 5 minutes for that. If I want to get a sample right away that isn't as sterile, I would go over here and I would take this tube right here, take it out, and then I would squeeze the urine into the container. And then once I'm done, I would insert it back in here, close up the lid, and then I would go and put on this label over here and send it off for testing. And okay, I'm gonna put that right over there. Then let me go and take away the supplies. All right. So now that I'm done doing that, I am going to remove my gloves because they are non-sterile anymore. Throw that out. And I'm going to also clean the perineal area off from the betadine. And to do that, I'm going to try to maintain sterility here. But I already threw out my gloves. I would take a clean towel. All right, so I would take a clean towel and I would wipe off the betadine. So long stretch towards the pelvic bone. And I would use a different part of the cloth every time I did a stroke. So that's a different stroke and that's a different stroke. All right, so throw this away, throw these away, take this away. All right, and we cover up the patient to maintain privacy. And please tell me if you have any discomfort or any questions. I'm going to make sure the side rails are up and then place the bed in a lower position. And then I'm going to monitor intake and outtake, and also I'm going to send this specimen off to the lab, and I'm going to report all this, document all of it, and report back to the doctor. All right, so if you do have any questions, please let me know. Let me wash my hands before leaving, and I'll see you later, Dr. Smith, Mr. Smith. Mr. Smith. All right. So today the doctor ordered me to take out your urine catheter. You just finished surgery and you did really well. Can you please state, let me go and check your armband. Can you please state your name and date of birth? All right, Mr. Smith, and you still don't have any allergies to iodine, biodine, latex, or anything else? All right, sounds good. And I'm also gonna ask that you state your date of birth, but before I begin, I'm going to explain to you, I'm going to take out your urinary catheter, and I'm doing this because you're done with surgery, and you don't need it anymore. So, I'm gonna wash my hands, put on some gloves, and I'm doing this also because the doctor ordered me to. So I'm going to adjust the bed, put the side rail down, and then put it up to working height. And then I'm going to remove this, have you in supine position with your legs kind of apart. I'm going to remove this. That's strapping it to the abdomen because you are a male. If you're a female, I would have it strapped to the leg. And then, so what I'm going to do is I'm going to take this syringe, I'm going to hook it up to the tubing port. And then what I'm going to do, I'm going to deflate the balloon that's stuck in your bladder that's holding it in place. But before I do that, I'm also going to have this underneath the urinary bag to collect the urine. So I'll take this down. And I also didn't hook this up to the bed rail, I hooked it up to the bed itself. Okay, so I'm going to grab your mediatus with my non-dominant hand. And after I've inserted this tube, I'm going to slowly withdraw all of the liquid that is inside of here. All right, and okay, I'm gonna make sure that's all the way off. And then I'm going to slowly remove it. And please tell me if you have any discomfort. Can you please, before I'm finished removing it, can you please take a deep breath in? All right, so I removed it all the way. I'm gonna dispose of this because it is not sanitary anymore. Remove this and also clean your perineal area using long strokes in case there's any leakage with a different part of the cloth. All right. So I'm gonna take this, put this away, maintain your privacy, and so I'm done with that. I'm going to put the side rails up, put your bed up, and I'm going to document all of this in DocuCare and report back to the doctor. We'll actually put it down and make sure also to have the side rails up. All right, if you have any questions or need anything, please tell me. Mr. Smith, I'm going to leave now, but not before washing my hands. All right, you have a good day. Thank you.